So this is a great question. I'm so sorry it took so long to get back to you, but neck and chin liposuction of this area is a great procedure. So it's low risk, commonly done, and there are some alternatives. So let's talk about all of it. So usually the way we do this procedure is make either an incision here or incisions here and here, numb this area up with a dilute numbing solution, and then pull that fatty fluid out with a suction cannula. And that whole process usually takes about 30 minutes at the most. So since it's a short procedure, it's pretty easy to numb this area. Most patients can tolerate this pretty well with no general anesthesia, so that makes the risk much less as well. The one thing to consider when you're having liposuction in this area is that you want to make sure that you're having the right thing done. That removing some fatty tissue from this area is really going to solve what the problem is for you. And often it's more than just that. There's some skin laxity that also needs to be managed. So this is an area that I love to add things to tighten the skin as well. So since with liposuction we only remove fat, the skin will tighten up somewhat, but it's nice to add some kind of energy source to cause the skin to tighten a little more. So there's a lot of them on the market. Renuvion, Body Tight, this would be Face Tight for this area, are the ones that I have the most experience with, but they work great. There's also options that go through the skin and don't require an incision, but I figure since you're already in there, you already have an incision, you might as well use the stronger ones that need an incision because the incision was already made. So say you really just don't want liposuction, you don't want an incision, just don't want to have surgery in general, there are some non-invasive options that can do a decent job. So you mentioned Kybella. Kybella's deoxycholic acid, we inject it in the area, it makes fat cells explode and then they get reabsorbed and it can shrink the fat in the area. Now cool sculpting is another option. Cool sculpting gets a bad rap, but it's like anything, there's risks and there's benefits. The benefit of cool sculpting is that you can freeze and kill some of the fat here. Usually about 20% of the fat will die with one cool sculpting session. Your body will reabsorb it just like it did with the Kybella, and cool sculpting also can tighten the skin somewhat. And then the last option is these radio frequency microneedling machines that can alter the depth. You can treat a little deeper to help shrink the fat up, and then you can treat more superficially to shrink the skin up as well. So it's important to recognize that if you're going to do any of these non-invasive things, that they take multiple treatments and they don't last forever. So although the fat loss and the fat removal is forever, the skin tightening isn't. So once you finish your initial series of treatments, everything's tightened as much as you want. Usually 20 to 30% tightening is what we would hope you would get from these minimally or non-invasive treatments. You're going to need to repeat that. And some people say every 5 years. I think every other year is probably better in my experience. So if they work great for you, you want to do it again in 18 months or 2 years. You don't necessarily need to do the whole series. So whatever platform you use, it's usually 3 to 5 treatments. You don't need to do all of them every other year, but maybe just one treatment every other year, and that seems to keep the collagen production just the right level to keep the tightness. So I hope that answered your question. Let me know if you have any more.